Hi and welcome back to my channel. Today I'm wearing a Bratz shirt. Who remembers Bratz? I figured since I'm home in Connecticut in my high school room, why not really just go all out and bring back the childhood. I think her name was Jasmine. Jasmine was my favorite. If that wasn't her name, I'm sorry, somebody could correct me, but that was unrelated. So today we're going to talk about panic attacks. The reason I want to talk about this is because I think a lot of people know what anxiety is, or there's a lot of talk about anxiety, but not necessarily talk about panic attacks, and they're related. However, panic attacks are much more severe than anxiety. So with anxiety, we know there's a lot of like worry, worst case scenario thinking, ruminating thoughts. Ruminating thoughts just means like we're kind of replaying things over and over and over again. Our mind is very preoccupied with doubt, fear, all of these things, right? Now, when this builds up past anxiety, we can hit a point of having a panic attack. It's very important to know what it is. And the reason that I wanted to make this video is because I was watching actually a video on Teen Mom, which I haven't watched in years and years and years, so I don't know why this came up, but there was a teen mom and her name is Chelsea, and she was talking about having a panic attack. Well, actually, she was talking about having so much anxiety that she thought there was something physically wrong with her, and so she went to the hospital. And this is common. I've had many clients who go to the hospital thinking that there is something physically wrong with them, not realizing it's mental health and it's a panic attack. So I wrote some notes to make sure I get all the points across. So if you see me looking down, that is why. Basically, a panic attack is a brief period of very overwhelmingly high anxiety. And what ends up happening is that it becomes so intense that you think that there are physical things wrong with you. People can explain it as they feel like they're having a heart attack or a stroke. Like something is so wrong with them that they go to the hospital saying like, I'm having a heart attack, something is wrong with me. And their heart is beating so fast because of the heightened anxiety or panic that is happening. It's usually not, I mean, obviously people have heart attacks and things like that, but it's not a physical issue. It's a mental health issue. And during a panic attack, there are many different symptoms that can be happening, but if we're going with the most extreme, a lot of times people, they can't breathe. They feel like they can't breathe. They feel like their heart is moving so quickly that it's literally a heart attack, or they think that they're dying because there's such intense emotions and feelings and physical pain and things that are going on that they think that they're about to die. Like that's how serious that this is. And so I'm going to go over some of the other symptoms, but some of the other symptoms are also just related to anxiety. So for example, you can experience sweating, which that can happen when you get anxious too and have worry. So sweating, trembling, shaking, you know, sometimes when there's so much adrenaline and worry running through you, you could feel yourself kind of like shaking and getting like, yeah, shaky. There's this feeling of, am I going crazy? Like, am I losing my mind right now because I have no control over my mind or my body? My thoughts are running 1,000 miles an hour and I can't stop them. I can't stop myself from thinking that I'm dying. So sometimes people say I literally felt like I was going crazy because I couldn't stop my body from shaking. I couldn't stop my mind from thinking all of these things. There could be a feeling of being detached from the situation. So I've had people who have told me like, I know that I was physically there, but I didn't feel like I was physically present. So sometimes a client might describe it as like, I was watching myself in the situation from like the outside of my body, or I was there, but I kind of felt like everything around me wasn't real. Like I knew I was physically in this place, but everybody seemed very far away, even though they were close. So there's this feeling of being detached, difficulty breathing, as I said, this sense of terror, which obviously if you think that you're dying or you're having a heart attack, you're going to have a sense of terror. Like the fear is unexplainable. Whereas with anxiety, you might know like, okay, I'm thinking worst case scenario and it's actually probably not that bad. And we can kind of talk ourselves out of it and think like, okay, do some deep breathing or take a break or whatever the case may be. But when it comes to a panic attack, the terror is so big. And the fear is so big and we feel like we've lost so much control that at this point you're like, am I dying? So another symptom is chest pains, which again is related to the increased heart rate if, you know, that's why people think they're having a heart attack, because their heart is racing so much that it's making them nervous. Like you could feel, you know, people say like my heart's beating out of my chest. It's just going so fast, and I am so worked up that I'm actually uncomfortable. I'm experiencing a sense of discomfort. Sometimes people feel nausea. So nausea, I don't know. You know, it's this like, you ever get so scared that your stomach drops, or you feel like you could throw up because you're in such a state of shock. So you could feel that. And then, you know, the fear of dying, like I've talked about, it's just this, you know, am I going crazy or am I dying? Am I having a heart attack or am I just not in reality? So there's a lot of different symptoms that can be going on in this situation. Now, some of the notes that I took, this is from me like Googling or looking on different places, so I can't say like this is just 100% me. But I wanted to see like how long they usually last and things like that. So panic attacks are usually brief but intense. The symptoms of panic typically peak within 10 minutes and end within 30 minutes. So it's not saying that you're in that intense fear for 30 minutes. It's saying that the peak is like adrenaline, running. We're up at 10 minutes. Okay, once we hit the top and we feel like we're dying, we're coming back down. We're slowly starting to regain our breath. Maybe our heart is slowing down a little bit. And usually by the 30-minute, half-hour mark, you're back to baseline. However, there could be some lingering feelings after that. Like you could still have anxiety, right? And a lot of times with panic attack, after the panic attack happens, there is anxiety there because people often fear like, when is this going to come again? Is this going to happen to me again? And so now they're living in fear of, I'm going to have another panic attack. And what if a common thing I've heard is like, what if I'm driving and I have a panic attack? Or what if I'm taking care of my child and I have a panic attack and I'm not okay? And so there's this intense fear of, we don't know when it's going to come. And if we can't be in control of it, like, what does that mean for me and the way that I'm going to be able to take care of myself and my body? So even though the panic attack ends, there's usually anxiety and things that come along after the fact. The other thing that I Googled was who is most likely to have a panic attack. And it does say that women are twice as likely as men to have a panic attack. Now, we can go into reasons why women experience anxiety more or panic attacks and things like that. But ultimately, it is found more commonly or more often in women. It also says that panic disorder is twice as common in women as men, and the symptoms often begin before age 25 and may occur into mid-30s. So the average, I guess, range is from 25 to 35 when you start to see panic happening. Although it could happen to anybody. You could be 50, you could be 19. I mean, these things, they don't have to be necessarily that, but that's just some of the research that I found. I will say that although a panic attack feels scary, and it feels like you could be having a heart attack, you're not in physical harm. How could you treat a panic attack? There's typically 4 different ways. You have CBT, which is a type of therapy, so you can go to therapy and kind of process what's going on and what's causing this anxiety and fear. You could do exposure therapy, which is a different type of therapy where you slowly expose yourself to something. So for example, if you have arachnophobia and you're afraid of spiders, then, you know, maybe you just talk about spiders in therapy, and then you at some point get a fake spider and you look at it, and then eventually you expose yourself to a real spider, whatever the case may be. That's exposure therapy. There's medication. You could see a psychiatrist and be prescribed medication for anxiety. And then also there's relaxation techniques. Now, if you're in the middle of a panic attack and you just pull a relaxation technique out of your pocket, it's probably not going to work. Relaxation techniques do best when you are already practicing them. So for example, having like daily meditation time or daily yoga time or daily journaling time. And even if it's not daily, at least like 2-3 times a week, but things that are more preventative than trying to do it right in the moment. Because when you're in the moment, it's a lot harder to bring yourself back and do deep breaths and all of those things. But if you are making a lifestyle out of things that help you relax, things that help decrease your worry or bring you to a state of peace or calmness or grounding, you're less likely to have them, although you still can have them. So my recommendation would be, if you have experienced a panic attack, please see a therapist, a counselor, go to your local mental health agency and talk to somebody about it and try to get a better understanding of where is this coming from, because it is coming from somewhere, and you can always work on it. And it might seem scary to talk about it, and it might actually bring anxiety up to talk about it. But ultimately, the more we repress things and just put them down, they're still there, and they do come up. You can't ever just fully run away from your problems, unfortunately, because trust me, I wish I could. But it is good and healthy to get help when it comes to anxiety and panic attacks. So please connect with a local resource, somebody that you know that can help you process these things and manage them. And, you know, it will get better over time if you're consistently working at it. So with that being said, thank you for your time. Thank you for watching this video. As always, if you have questions, you can put them in the comments below or contact me. I will do my best to help with any clarification and things like that. So please enjoy the rest of your day, and I will see you in our next video. Our next video, because we share this time together. Yeah, I'll see you in the next video, and thank you.